Hi, this is Belle again. We are now on Module 4. Module 4 will cover documentation. In this module, we will talk about the medication administration packet, recording information, and also making and recording observations. So we want each participant to be able to identify proper forms that must be completed for medication administration, recognize and record signs and symptoms and side effects of medication. So we will get started. So again, the medication administration packet should be completed before we start giving medication. The authorization to give medication, the receiving medication log, the medication log all needs to be filled out prior to administering medication. So in the medication administration packet, the medication log is completed by the staff who is going to administer the medication. The medication log, again, includes name of child, medication, day, time, dose, route, signature of staff, needs to be included. Reported any errors or mishaps need to be put in the medication log. Return or disposal of medication also has to be reported in the medication log. In the medication log, also, we have the as needed medication. We want to write the reason why the medication was given. We want also very specific instructions on the as needed medications. We did talk about over the counter medications should be logged, but should be prescribed by a healthcare professional. With a medication log, each child should have his or her own log. Every dose of medication must be recorded to prevent dosing errors. Again, if we are administering medication, that is all we're doing, because if we just did not jot it down, remember, it did not happen. So we need to make sure that when we administer that medication, we take time to record that medication was given. So every dose needs to be recorded to prevent any errors. If somebody comes and says, oh, this child did not receive their medication because we did not document it, know that that could be a double dosing of that medication, and it is definitely an error and it could cause harm. So again, we want to make sure that we record every dose of medication to prevent dosing errors. We want to record the right place where the medication was given. We want to do it right away. I gave this medication, we want to record it. Having that record keeps track and proves your actions, that I followed the procedure, I followed protocol when administering this medication. You want to record any unusual circumstances. What happened? We want to make sure that we jot that down. Remember that this log, your medication log, is a legal document. It is a legal document. Let's say that there is an error. You just want to make one line on that error. You want to initial. You want it to be legible, what you marked off, and you want to be legible. So if something were to happen, you have written the corrected statement or whatever was done, because it is a legal document. And trust me, it will be held against you in a court of law if need be, if procedure was not followed, if the protocol was not followed, it will be held against you in a court of law. Promise, the fours will be called, and this is just to protect the child and to protect you as well. So continuing with the medication log, you always want to write legibly. You want to write in ink. Never use whiteout, ever, ever. If there's an error, recording error, you cross out again with a single line, you make the correction, and you initial. If there's a blank line, put NA so no one may write something in there or anything like that. So you're going to write NA for not applicable. And then if there's a witness that needs to sign, have someone that witnesses sign along with you. So records must need to be kept for as long as your state requires them to be kept. Parents should be able to get a record of medication given as well. So remember that those are done upon request at times if parents need records of medication that was given. Observations when we stay and just have keep an eye on the child for possible side effects. We want to note anything in the medication log that possible was a side effect, an itchy, hives or anything. You want to make sure if something was noted that it is put in the medication log. You also want to record incidents. For example, a child refusing to take the medication, if there was, some of it that was spit up, that kind of thing. So you want to note these. It's also a place that perhaps you can note successful techniques that helped the medication be take their medication and cooperate with you. So you want to jot those down as well. So again, you want to make sure that recording that every time you give medication that it is recorded. You want to record the dose of the medication in your medication log. So whatever is required to be put into the medication log, you want to make sure that it is put in there. The dose, the time, what your observations were, your signature, the name of the child, these kinds of things. You want to make sure that everything is put in there. Again, continuing, we go back to Nick. You put in Nick's name, maybe the weight of the child, his amoxicillin, the date it was given, the time, how much you gave him by mouth, and then you're going to sign that you were the one that gave him the medication. If it was Maria, how much did Maria weigh, that you applied the hydrocortisone cream, 1% at 12 noon. Maybe the actual time that you gave it was 12:30. You put that in, a thin layer on the skin, maybe on the elbow or wherever it might have been, and then your signature. We're going to continue to Module 5. We're almost done if you will bear with me. Module 5 is problem solving. We're going to talk about medication errors, medication side effects, medication incidents, and what to do for problems and how to document them. We're going to talk about also maybe that we're on a field trip. We're going to talk about self-administration and then problems that may arise we want to discuss in this last module. If you will bear with me, this is our last module, so we will get through it. Thank you. Here we go. So communication and care, again, preventing errors begins with communication. When the parent drops off the medication, you want to ask when was the last dosage that was given. How did the child react to the medication? Is there a way that the child likes to take that medication? If the child is older, then you want to have direct communication between the child and when you're going to give the medication. Also, you want to think about the responsibility triangle, the child in the middle, the parent at the top, the healthcare provider, and then the person that works with the child care, right? You want to make sure, is everybody in communication? Is everybody on the right page? Remember, we are looking out for the well-being of the child. Everybody's working to make sure that it's the best outcome for that child. So communication is key. So let's talk about a medication error. What is a medication error? A medication error is when one of the 5 rights went wrong. Okay, so medication error would be the wrong child, right? The medication was given to the wrong child. The child was given the wrong medication. The child was given a wrong dose. The child was given the medication at the wrong time, or the child was given the medication by a wrong route. Any of the 5 rights gone wrong is a medication error. The best way to prevent medication errors, again, is to make sure that we are focused and we're just paying attention to what we are doing. We want to make sure to avoid any potential harms, any potential errors, because they can be serious depending on the medication, depending on the child, depending on the dose. So we want to make sure that we are giving the right dose to the right child with the right medication, the right time, the right route. Giving the wrong dose of a medication could overdose, could underdose, could miss dose. Some medications you need to keep taking them for them to work properly, right? If you skip a dose, then sometimes the medication doesn't start working again. So these kinds of things. So we want to make sure that we follow the instructions, that were given to us. We follow the policy and procedure of how we do things and make sure to avoid um, any error on our part. We want to be able to do our best to make sure that we are following the procedure and help prevent any medication errors. So preventing medication errors, you want to look at the pattern of errors. What is this? How do we brainstorm to prevent errors? What's going on? Why do we keep having these errors? Do we need to buy devices so that are the devices that we have, the dosing devices, are there not ones that maybe are for the ages of the children that we serve? That kind of thing. Are we forgetting to give the medication on time? We're so busy that by the time we look up at the clock, it's past noontime and we did not give the medications. Then setting alarms, to remind us to give that medication. So we want to make sure that we log everything that we do. We, think about how we can prevent errors. Can we make sure that one person's doing it all the time? Maybe it's the person that communicates well with the child, or with the children, these kinds of things. But we want to make sure that things are in place to avoid medication errors. Side effects to medication. A secondary and usually adverse effect of taking medication is the common side effects to include upset stomach, include diarrhea or loose stools, the dry mouth, drowsiness, the change in activity or mood, maybe dizziness, maybe a little sweating or rash, or maybe they feel a rapid heartbeat or nausea. So what are these side effects? We want to minimize side effects. That perhaps if we give an antihistamine, the dryness right after an antihistamine, it dries you out. It could cause drowsiness. So we want to make sure that we don't give an antihistamine right before we're going to put a child at PE or recess. They're going to be up, on playground equipment. They could lose their balance or they're not coordinated because they're a little drowsy. So we want to take things into effect. How can we safely administer the medication that we have to? Let's use our best practices when administering medication. Again, some side effects to medication can vary. One child may not have any side effects, another child may. You've heard that Benadryl makes some children very drowsy. Some parents would say, "Oh no, not mine." It makes them very jittery and hyper. So how do the children um, react to these medications, right? What are the effects the medications have on the child? So being aware of that. So again, a side effect could be normal for one child from a medication. It could be abnormal for another. Let's say that one child is taking albuterol and they feel fine. The other child perhaps feels their heart is racing so fast and they worry and they panic, and the more they become anxious, the worse it gets, right? So knowing to be calming, to having them relax, maybe just sitting them quietly, those kinds of things. So being prepared is key. Being prepared and knowing of possible side effects and how they affect the child that we're administering the medication to. So again, we want to be knowledgeable about side effects, medication side effects. We want to read the labels or the package inserts, maybe information from the pharmacy, maybe telling the parent If there's any side effects that the child has experienced from taking the medication, we want to also see the child's health assessment. Is there anything written in there, that has been put down, um, that the child is reacting to this kinds of things. So we want to be knowledgeable about the different medications we are administering. Um, Now, side effects are different than reactions, right? Side effects are different than adverse effects. Adverse effects we do not want to happen. We want to avoid these. These are undesirable experiences associated with the use of a medication that is given to a patient, perhaps fainting, vomiting, or seizures, or long term effects. These are things that we need to if there's an adverse effect that we need to be aware of, and we need to make the healthcare provider aware of these adverse reactions. Maybe severe allergic reactions. If it's a little rash, not bad, but if it's a rash and it gets worse, maybe swelling, maybe their difficulty talking, difficulty breathing, difficulty swallowing, these are allergic reactions that can be life-threatening. They're severe. So allergic reactions can vary from very mild, a little itching, a little rash, to where it can become severe and life-threatening. So remember that anaphylaxis, people can die from anaphylaxis. So we want to be ready. If that happens, as a child starts having difficulty breathing, we want to make sure that we call 911. If they have an EpiPen that they have prescribed for them, that we use that EpiPen. So we want to be ready in a life-threatening situation or in severe cases, because it could result, like I said, in that complete airway obstruction or shock or death. So we want to be ready. We never want to leave the child. We want to get somebody else to help you cry out for help, right? So again, very important that we take some time to observe the child after we give a medication, to make sure that we make sure they're not having any side effects. Again, side effects turning into adverse effects or allergic reactions. So very careful observation is essential after we give a medication. So medication incidents that are not errors. We're not talking about errors. We did everything wrong, but the child refused. I'm not taking that. I'm not. They spit out the doses. They vomit the doses. Spilled medication. They hit it. Maybe the hand slipped and they hit it. These are medication incidents that we need to document and let people know that it happened. But 9 out of 10, unless told by the healthcare provider, we do not give the medication over again, especially if they spit some out. We don't know how much was spit out, that kind of thing. So what do you do for medication errors, adverse effects, or allergic reactions? You want to act quickly. If there's an error, effect, or reaction is recognized, failure to do something will result in harm to a child, and you want to stop from further harm happening. So if a child's in distress, you call 911. You notify the center director if it's not that serious, but there is an error that has happened. So you want to call the center director. You want to notify the parent or guardian. Think about it. Sometimes, we're human. We're doing the best we can. We're following all the protocols, but something happened. We as the parent would want to know. So we as the people that take care of their children need to notify the parent. So we want to notify the parent or guardian. We want to fill out a medication incident report. So again, in the center, you want to notify your director. If it's a distress type of situation, you want to call EMS. You call 911. Again, you have someone else call 911. You do not want to leave your child alone. You want to stay with them. You want to record and report what happened. Many times you'll have to call poison control. You want to contact their healthcare professional. If you do have a child care health consultant, you want to notify them. Many times there will be other agencies that need to be notified. So you follow the procedure for your organization if something were to happen with medication administration. So, what do you do for medication incidents? Again, the dose is not repeated. You do not repeat the dose because you're unclear about how much medication was absorbed when the child took the medication, maybe expelled it. So you do not repeat the dose. You always notify your center director, or I think yours is the healthcare team. So you notify your healthcare team, you notify the parent, guardian, you fill out the medication incident report, and you develop and document a follow-up plan. Many times we contact the healthcare professional or again the child care health consultant. But again, never repeat the dose because we do not know how much the child was able to keep down. So unless specified by the healthcare professional, the dose is not repeated. So again, when should you call 911? If you start to see signs of distress, call 911. When there's loss of or change in consciousness, you call 911. The blue, right? The tinge blue around the mouth, maybe the fingers, difficulty breathing, difficulty talking, difficulty swallowing. You want to call 911. If the swelling of the lips, tongues, face, the drooling, if you see drooling, you call 911. Any seizure activity, you want to make sure the child is safe. They're not going to hurt themselves. If they're having a seizure, you stay with them. Call 911 immediately. The rapid spreading of the hives or rash, you call 911. Impaired speech or mobility, you call 911. If things are getting worse quickly, call 911. When in doubt, call 911. Very important. The safety of the child is what's at hand here. So we want to be safe than sorry. So call 911. Call for help. You should always access 911. Also, you can access poison control. You can access poison control to through 911, or there is a poison control number 800-222-1222. When medication is given to the wrong child, when the wrong medication is given to a child, when the wrong dose is given, maybe an overdose, when a medication is given by the wrong route, when medication is given at the wrong time, and usually it's because an extra dose was given, we want to call poison control and inform them again. You want, it might not be necessary to call poison control for a missed dose. I wouldn't do that, or the wrong time again, but you do want to call the healthcare professional if the missed dose was done, if they want another dose to be given, or just wait till the next dose. So again, if you are going to call poison control or 911, you want to have information about the child readily available. If you know the child's weight, which usually is found in the medication log, the medication container. You want to know the child's medication administration packet. You want to have that information with you. You want to have the information for the emergency contact for that child. So off your, you can get that information off your emergency contact form. Again, these are things to have readily available for when calls are made. These questions are going to be asked. So you want to make sure that you have that information ready for them. So again, the medication incident report to be completed by the person who administered the medication or his or her supervisor. Very important that it is filled out. Also, documenting. You've got to document an error or an incident. Very important. There's policies and procedures for these situations. You want to make sure that that is documented. Make note on the medication log of what happened. You want to complete the medication incident report. You also want to follow up according to the child's care to the child care facility policy. What is that we do next? So you want to call your supervisor. Um, you want to call Dr. Jones' staff to guide you on what needs to be done next. So again, let's do a scenario going to poor Nick, right? We're picking on Nick today. You gave Nick his dose of amoxicillin at noon and recorded it at 12:30. You know that Nick is scratching his arms and he's developing a rash on his arms. He's happy and playful and is not having any breathing difficulties. You notify his parents who calls his healthcare professional. Nick is picked up at 1 p.m. and is brought to the healthcare professional's office where he receives Benadryl. His amoxicillin is discontinued and he's given a new antibiotic. So again, this is a side effect, right? It's a side effect. It's not an adverse reaction. It's just a side effect. His healthcare professional now has given him a different medication. Of course, you're going to switch out the medications, right? Give the old medication of amoxicillin to the parent, log in the new medication, log out that you gave that old medication to the parent. So all the paperwork is done. So for Nick, Nick is doing pretty good. He just had a little bit of an allergic reaction. So you do fill out his medication incident report of what was done. And again, you fill out the form completely. You don't leave anything blank. You make sure that you sign the form as well. Some other resources, again, like we said, there's the child care health consultants, and then there's a national resource center for health and safety in child care. That's 1-800-598-KIDS. You have resources with your local pharmacist, the child health care professionals, so the doctor, nurse practitioner, or PA, whoever treats the child. Also, one of great resources that we have locally is Driscoll Children's Hospital, that many places don't have a children's hospital. We are blessed that we do. So take advantage of that. We do have that children's hospital here locally. Again, if transportation provided, let's say that you go on a field trip. Right now with COVID, I don't think we're traveling much, but let's say that there is a field trip that is scheduled and the child care facility is transporting the children. A, a staff person has to be authorized to administer medication, should be present when supervising the child outside the child care facility grounds. So medication should be properly secure and labeled. I think last we gave this presentation, there's a backpack that is carried by one of the um, teachers, I want to say, or one of the staff members. They make sure that the medication is available for the children or for the child that needs it. You want to make sure that there's proper temperature is kept and conditions for the medication are maintained. Copies of the emergency contact just in case something does happen. The child's medical forms should be carried in case 911 is called. Then that information is available to whoever is making the call. So again, the medication has to be, all the logs have to be filled out, all the paperwork has to be filled out. If there's any side effects, that needs to be noted. Again, when outside the facility, you still have to wash your hands. You need to make sure that good hygiene is being kept and maintained when administering medications, whether in the center or outside the center. And again, a cell phone has to be made available to call 911 if need be. For older children, talking about older children, um, they may it may be appropriate for them to carry their own emergency medications. so they self-administer. So it depends on the prescriber recommendation, the student factors, the parent or guardian allows that, what's the policy for the school, and what the state policies are or the laws are for self-administration. So again, medications that should be considered for self-administration could be like the EpiPen or asthma inhaler, insulin, other medications that the with written consent from the parent and the healthcare provider. Um, it could be a possibility for a child to self-administer their own medication, but you need to take into account the child's age, their competency level, whether they're able to or not. So we want to make sure that all that is noted before a decision is made if a child can self-administer medication. And whatever the decision is made, it needs to be documented and everybody is aware of what the uh, policy is going to be or what the procedure is going to be for that child. Again, there may be an occasion when you must refuse to give a medication. Again, remember that as the person that's administering the drug or medication, you have the right, if you don't feel comfortable administering that medication, you have the right to refuse. Perhaps you don't have special training, you don't feel comfortable, you are uh, at liberty to voice that, I don't feel comfortable giving this medication. I don't feel that I've been trained to give this medication. So you need to voice that concern. Also, maybe some the authorizations or signatures are not in place. Documentation is lacking. This may be another reason that you refuse to give the medication. Again, you can voice that concern. You can call the healthcare team and say, the documentation's not in order. The parent is making an inappropriate request. I don't feel comfortable doing it. Um, if it's against facility policy, do not do it. Do not put yourself at risk. You maybe want to do it with a kindness of your heart because you feel bad. The child really needed it. If it's not documented, if it's not, you're not following the facility policy, the center's policy, you're not trained. If something were to go wrong, you will be held liable. So again, you're looking out for the interest of the child, but also taking care of yourself. Again, inappropriate requests, if it's over the counter drug that or medication that is not been authorized by a healthcare professional, do not give it. If it's not in a container that's properly labeled, do not administer it. If it was uh, um, a mother, please just give it to them real quick. I already, I didn't have time to give it to them at home and they've given it to me in a baggie. You cannot do it. I'm so sorry. I really would like to, but I can't. That is not, it's for the safety of your child, our safety, the center's safety. So again, it's not our policy and we follow protocol here. Again, know that if you do it for one person, another person will hear about it. I heard that you did it for so and so, that kind of thing. So it's best to always follow the center's policy when administering medication. Um, Again, please have your medication administration policy available, and a parent should have a signed copy so they won't feel like, well, no, you just play favoritisms, you don't want to do it for me, for my child. No, it's a policy, and here is a copy of the policy. You want to make sure that that's never an issue. You want to just nip that real quick. We're just going to take care of that right now. Here's the policy, and all of us here at this facility follow the policy. It's for the protection of your child. So you want to make sure that they are very aware that we do not follow protocol here. So if there's special training that needs to happen, Make sure that that training is done before you administer a medication. If a dose is missed, you want before administering the next dose or repeating the dose, you want to make sure that it's okay with the healthcare professional, whatever they say, whether go ahead and administer it now and then follow the dosing afterwards, or just skip it and wait till the next dose, that kind of thing. So you want to make sure that you follow the protocol and the advice of the healthcare professional. So again, when dealing with parents that maybe want you to do something that is not appropriate, you want to state something to this effect. I'm sorry, but according to our policy, or you want to use the line, I do understand, but for the safety of your child and the safety of the other children in our setting. And so these are responses to parents that are maybe asking for us to do something that is not appropriate, or that is not part of our policy. The other thing you can do is you can call your supervisor. You can call the healthcare team that's part of Dr. Jones's team to make sure that they talk to the parents, that they may ask the parents to make other arrangements, that kind of thing. So, again, our job is to protect the child, and our job also is to protect ourselves and the center that we work for. Thank you so much for your time. Believe it or not, this is the end of our modules. I want to thank you for your time and wish you the best of luck through this year and on to next year. I can't believe the year's gone by. So thank you so much. Have a wonderful day.